Hello friends, in this video I'll cover 200 previous NEET one-liners that are asked in medicine. Okay, so keratoderma blemmarechica is seen in Rhetor's disease. Keratoderma blemmarechica is seen in Rhetor's disease. Patrick test is done for sacroiliitis. So Patrick test, remember, Patrick test is for sacroiliitis. Okay, microalbuminuria is the most reliable marker of diabetic nephropathy. ACE inhibitors are given as nephroprotective drugs. Unconjugated bilirubin is absent in urine because it is attached to albumin. Okay, it is attached to albumin. Unconjugated bilirubin is absent in urine because it is attached to albumin. Unconjugated hyperbilirubinemia is seen in hemolytic anemia. 5 nucleotidase activities increased in cholestatic disorders. So in cholestatic disorders where the bile is remnant, 5 nucleotidase activity is increased. HIDA scan is done to diagnose acute cholecystitis. So acute cholecystitis, you do HIDA scan. HIDA scan is done for acute cholecystitis. Earliest dyslipidemia to occur in diabetes is triglycerides. Legacy effect or metabolic memory is related to serious complication in diabetes mellitus. So legacy effect or metabolic memory is nothing but like when you start the treatment in the early stages, when fasting blood sugars are around just 125, 130 or 135, the occurrence of complications, especially serious complications, is delayed. So the metabolic memory is retained. The body will remember the good control of sugars from the early stages, and the complications is prolonged. The time of occurrence of complication is prolonged. That is called legacy memory or metabolic memory, seen in diabetes mellitus, especially for serious complications. Telmisartan is the only ARB which acts as a PPAR gamma receptor. So telmisartan is PPAR gamma receptor, and it's the only ARB which acts on PPAR gamma receptors. Seroglitazar acts on PPAR alpha and gamma receptors. So seroglitazar acts on both alpha and gamma receptors. So telmisartan is the only ARB which acts on PPAR gamma, and seroglitazar acts on both PPAR alpha and gamma. Telmisartan for gamma, seroglitazar for alpha and gamma. Councilman bodies are seen in acute viral hepatitis. The commonest hepatotropic virus progressing to chronicity is HCV. Chance of vertical transmission hepatitis B is 90%. Microalbuminuria is the most reliable marker of diabetic nephropathy. Erythromycin acts on motilin receptors. In diabetes mellitus, third nerve is involved most commonly, but pupillary reaction remains normal. This is very important. So third nerve is most commonly involved in diabetic mellitus, but pupillary reaction is normal. Callus formation is the earliest manifestation in diabetic foot. So callus formation is the earliest manifestation of diabetic foot. Edema in nephrotic syndrome is predominantly due to hypoalbuminemia. The most common cause of nephrotic range proteinuria in adult is diabetes mellitus. In an adult is diabetes mellitus. True about light microscopy is minimal change disease is no change seen. Okay. See, light microscopy, no change is seen in minimal change disease. Tram track appearance is seen in membranous proliferative nephritis. Maybe tram track is seen in MPGN. Okay, tram track appearance is seen in MPGN. Acute infection of hepatitis B virus is diagnosed by IgM antibody of HBC. Acute infection of hepatitis B virus is diagnosed by obviously when IgM it is always acute. Okay, antibody of HBC. Okay. Hepatitis B infectivity is indicated by HBsAg plus HBeAg. Okay, so what they have given before, acute infection of hepatitis B virus is diagnosed by IgM antibody of HBC. Hepatitis B infectivity is indicated by HBsAg and HBeAg. Reverse transcriptase of hepatitis B virus is coded on P gene. So remember, P gene of hepatitis B virus codes, reverse transcriptase. Critical ischemia for peripheral arterial disease is ankle brachial index. Okay. A critical ischemia for peripheral artery disease is ankle brachial index of 0.3. Okay, so critical ischemia for PAD, peripheral artery disease, is ankle brachial index of 0.3. J curve phenomena is related to hypertension. So J curve phenomena is related to hypertension. Most sensitive test for renal vein thrombosis is CT angiography. So in renal vein thrombosis, you can get contracted kidney unilateral, and generally there can be missed kidney in ultrasound, like you cannot see one kidney in ultrasound in renal vein thrombosis. This is another MCQ for renal vein thrombosis. So most sensitive test is CT angiography. Post-streptococcal glomerulonephritis, secondary to skin infection, is more common in summer. Malignant otitis externa is seen in Pseudomonas infection. Rhinocerebral mucormycosis is fungus. Reverse transcriptase of hepatitis B in P gene. IgA nephropathy is seen in mesangial proliferative glomerulonephritis. IgA is seen in mesangio proliferative. Okay. And bronchial asthma is best diagnosed by demonstration of reversible obstruction. Demonstrated by the reversible obstruction. In idiosyncratic asthma, IgE is not increased. In idiosyncratic asthma, IgE is not increased. Aspirin sensitive asthma is associated with nasal polyp. Charcot-Leyden crystals consist of granules of eosinophils. Bradycardia indicates the most severe attack of bronchial asthma. Okay, bradycardia indicates the most severe attack of bronchial asthma. Montelukast is not useful in the treatment of patient with acute bronchial asthma. So if it is acute bronchial asthma, Montelukast is never useful. Bradycardia indicates the most severe attack of bronchial asthma. Okay, bradycardia indicates the most severe attack of bronchial asthma. Okay. So cerebral edema is the most dangerous complication of DKA. So what is the most dangerous complication of diabetes ketoacidosis? Cerebral edema. Insulin resistance in liver disease is due to steatosis. Okay, in liver is due to steatosis. Type of glomerulonephritis is least likely to cause chronic renal failure, minimal change, glomerulonephritis. So which type of glomerulonephritis causes CRF least? Is minimal change. Signs and symptoms of CRF appear when GFR goes down below 50%. Okay, then only you call as severe renal failure. Okay, and in between 20 to 50 you call renal insufficiency. No, below, yeah, renal insufficiency is less than 20% of normal GFR, I think, and renal failure is 20 to 50%, and less than 50% is end stage renal disease. Something, you please cross check those definitions. Painful pericarditis is not a feature of CRF. Restless leg syndrome is seen in chronic renal failure. And what's the treatment for it? Ropinirole. Okay, chronic renal failure. Treatment of restless leg syndrome is gabapentin. So gabapentin can also be given. Sorry. So ropinirole is also used for restless leg syndrome along with gabapentin. Nail and half nail sign seen in uremia is increased capillary density at distal half of the nails. So uremia, it's not proximal, it's distal half of the nails where there is increased capillary density, and so nail and half nail sign is seen. Band shaped keratopathy is most commonly seen in CRF. So this is all about CRF. CRF, you see, band shaped keratopathy. In digoxin poisoning, dialysis is not done. In digoxin poisoning, dialysis is not done. Fluid used in peritoneal dialysis is dextrose. Ankylosing spondylitis is associated with HLA-B27. The Schober test is done for ankylosing spondylitis. So Schober is for ankylosing spondylitis. The treatment of choice in seronegative spondyloarthritis is indomethacin. Treatment of choice for seronegative spondyloarthritis is indomethacin. Subcutaneous nodules is not seen in Reiter's syndrome. Chlamydia most commonly causes reactive arthritis. Succinate belitis is seen in Reiter's syndrome. We are also read like Keratoderma blennerhagica is also seen in Reiter's syndrome. Succinate balanitis is also seen in Reiter's syndrome. Okay. So increase in LDH is seen in PNH. Okay. Ham test is based upon acidic medium. So Ham test is based upon acidic medium. Increase in LDH is seen in PNH. Okay. And preventing treatment of PNH is eculizumab. So eculizumab is a preventing treatment of PNH. Ham test is based on acidic medium. Increase in LDH is seen in PNH. Lesion in inferior frontal gyrus causes motor aphasia. So inferior frontal gyrus, some lesion is there, it causes motor aphasia. Acute fatty liver of pregnancy occurs most likely at 32 to 36 weeks of pregnancy. Test performed to detect STUND, that is reversible myocardial ischemia. Reversible myocardial ischemia is PET scan. Ranolazine is used for the treatment of angina. Okay, ranolazine is used for the treatment of angina. Death in acute myocardial infection with thrombolytic therapy is due to intracranial hemorrhage. The commonest cause of intracerebral bleed is hypertension. Okay, lacunar infarcts are caused by lipohyalinosis of penetrating arteries. So lacunar infarcts are caused by lipohyalinosis of penetrating arteries. The most common location of hypertensive hemorrhage is putamen. This is a repeatedly asked question and important bit. So where does the hypertensive hemorrhage happens? Putamen. The most common site of hypertensive hemorrhage is putamen. Posterior communicating artery aneurysm can cause compression of oculomotor nerve. So posterior communicating artery, now that is PCA aneurysm, okay, can cause compression of oculomotor nerve. Watershed infarct is most commonly seen in which organ? Brain. Okay, watershed infarct is commonly seen in brain. Okay, type 1 diabetes mellitus HLA D3 and D4. Type 2 diabetes mellitus initially serum insulin levels are very high, that is hyperinsulinemia. Okay, most common murmur in acute myocardial infection is mitral regurgitation. Dressler syndrome is seen in MI. Okay, myocardial infarction. Dressler syndrome is seen in MI. The Addison's disease hypoglycemia is seen. A high amylase level in pleural fluid is seen in malignancy. Addison's disease hypoglycemia is seen. A high amylase level in pleural fluid is seen in malignancy. The presence of cholesterol crystal in pleural effusion is a feature of myxedema. So the presence of cholesterol crystal in pleural effusion is a feature of myxedema. So if amylase is present in pleural fluid, it is malignancy. If cholesterol is present, it's a feature of myxedema. Panda sign in sarcoidosis is seen in gallium scan. So panda sign in sarcoidosis is seen in gallium scan. Just remember, panda sign in sarcoidosis is seen in gallium scan. So panda sign is seen in sarcoidosis and gallium scan is used for it. Treatment of sarcoidosis is steroid. Mitra clip is used in the treatment of MR. Okay, Mitra clip is used in the treatment of mitral regurgitation. Pleural plaques are seen in asbestosis. So asbestosis, you see pleural plaques. Sickle cell disease commonly can cause PAH. Okay, so sickle cell disease can cause PAH. Pulmonary capillary wedge pressure is not seen in precapillary pulmonary hypertension. Lucid interval is seen in extradural hemorrhage. So very important, lucid interval is seen in extradural hemorrhage. Okay, extradural hemorrhage. Okay, commonest cause of Extradural hemorrhage is lucid interval. Okay, extradural hematoma occurs most commonly due to trauma to temporal bone. So extradural hematoma occurs most commonly due to trauma to temporal bone. Okay, extradural hematoma occurs due to most common due to trauma due to temporal bone. Commonest cause of tricuspid regurgitation is scar pulmonale. So what's the commonest cause of tricuspid regurgitation? Scar pulmonale. The commonest cause of tricuspid regurgitation is scar pulmonale. Carvalho's sign is seen in TR, that is tricuspid regurgitation. See Carvalho's sign, just remember. Dressler syndrome is seen in MI, and Carvalho's sign is seen in TR. Okay. Pulmonary valve is least commonly involved in rheumatic heart disease, which is least commonly involved pulmonary. Okay. Graham-Steele's murmur is heard in pulmonary regurgitation. So Graham-Steele's murmur is heard in pulmonary regurgitation. Remember, Graham-Steele's in pulmonary regurgitation. The marker for B lymphocyte is CD19. Seizure with mental retardation and sebaceous adenoma are the diagnostic features of tuberous sclerosis. So in tuberous sclerosis you see seizures and MR and sebaceous adenoma. Sebaceous adenoma, seizures and MR are seen in tuberous sclerosis. Endotoxic shock is initiated by endothelial damage. In ABPA, proximal bronchiectasis occurs. That is Aspergillus bronchopulmonary, acute bronchopulmonary aspergillosis. Okay, proximal bronchiectasis occurs. A patient is said to have chronic diarrhea if it is occurring for more than 4 weeks. So more than 4 weeks it is called as chronic diarrhea. Giardiasis is a parasitic infection that can lead to malabsorption syndrome. Microfilaria in blood is not a feature of tropical pulmonary eosinophilia. Insulin-induced hypoglycemia is the most accurate test to diagnose hypopituitarism. So what is the most accurate test for hypopituitarism? Insulin-induced hypoglycemia. Okay, insulin-induced hypoglycemia. In acromegaly, the most common cause of increased heel pad thickness is heel injury. Okay, I don't know. I doubt this bit. Okay, a lesion in paracentral lobule causes contralateral foot weakness. A lesion in paracentral lobule causes contralateral foot weakness. Okay, you just remember a lesion in paracentral lobule can cause contralateral foot weakness. Okay. Low serum haptoglobulin in hemolysis masked by burns. So low serum haptoglobin in hemolysis can be masked by burns. Hemolysis is most likely to occur in army soldier. Alpha fetoprotein levels are normal in fibrolamellar hepatic carcinoma. So some bits are directly past questions are directly converted into one-liners. So sometimes it is confusing. Okay. Even the negative points are converted to positive points. So it is little confusing. So whatever is important, you just grasp it. Alpha fetoprotein levels are normal in fibrolamellar hepatic carcinoma. Okay, no increase in alpha fetoprotein levels. Hepatomegaly is not the important feature of porphyria. Okay. Barrett's esophagus is commonly associated with adenocarcinoma. Just remember, Barrett's esophagus is associated with adenocarcinoma. I think this is worldwide. In India, it is just cross check. Adenocarcinoma is associated with Barrett's esophagus. McConnell sign is seen in pulmonary embolism. So, pulmonary embolism you see McConnell sign. And Carvalho's sign is seen in tricuspid regurgitation. McConnell sign. Okay, McConnell sign is seen in pulmonary embolism. Caisson's disease is due to gas embolism. Okay. Caisson's disease is due to gas embolism. McConnell sign is due to pulmonary embolism. Gas embolism, Caisson's disease. Caisson's disease for hydrated disease. Primary spontaneous pneumothorax is common in young age. Angina pectoris is best diagnosed by history. This is also important. Looks simple, but certainly it is a repeated question. Okay. In SLE, characteristic kidney lesion is wire loop lesions. So wire loop lesions are seen in SLE. Shrinking lung is seen in SLE. So shrinking lung is seen in SLE. Wire loop lesions are also seen in SLE. Wire loop lesions in kidney, shrinking lung is seen in SLE. Normal BT and PT, but PTT is increased in APLA. Okay. So bleeding time and platelet prothrombin time are normal, but PTT is increased in APLA, that is anti-phospholipid antibody syndrome. Okay. So anti-phospholipid antibody syndrome, partial thromboplastin time is increased and prothrombin time and bleeding time are normal. U1 RNP antibodies is most important in the diagnosis of mixed connective tissue disorder. So U1 RNP are important for diagnosis of mixed connective tissue disorder. Sapporo criteria is used for antiphospholipid antibody syndrome. So Sapporo is used for APLA. Ophthalmoplegia and hemolytic anemia occurs due to deficiency of vitamin E. I didn't know this. So vitamin E deficiency causes hemolytic anemia and ophthalmoplegia. Carbamazepine is not used for the managing status epilepticus. Catamenial epilepsy occurs most commonly in young ladies. So catamenial epilepsy occurs in young ladies. Part of the brain that is responsible for narcolepsy is hippocampus. So hippocampus narcolepsy. Okay, just remember narcolepsy is hippocampus. Abscopal effect is related to radiation to spleen. So abscopal effect is related to radiation to spleen. Abscopal effect. Parkinsonism can occur in Wilson disease. So Parkinsonism can occur in Wilson disease. So Pick's body in Pick's disease is tau protein. TAU, tau protein. Pick's body is a tau protein. CSF findings seen in tubercular meningitis is increased protein, decreased sugar and increased lymphocytes. This is very important. Characteristic of TB, you get decreased sugar. Okay. Characteristic of TB is you get decreased sugar. Decreased sugar is seen in TB. Okay. So increase in protein and decrease in sugar and increase in lymphocytes. Characteristic finding in CT in a TB is exudate seen in basal cistern. So just now we saw hippocampus narcolepsy and putamen hypertensive hemorrhage, and here TB basal cistern, exudate in basal cistern. Exudate in basal cistern is seen in TB. Okay, TB you see exudate in basal cistern. True about CSF finding in TB meningitis is chloride and glucose. Decrease in sugar is there. Okay, increase in lymphocytes and increase in protein is there. The drug of choice in herpes simplex encephalitis is acyclovir. The drug of choice in herpes simplex encephalitis is acyclovir. The drug of choice in treatment of acute bacterial meningitis is ceftriaxone. So acute bacterial meningitis you give ceftriaxone. Myoclonic seizure typically seen in Creutzfeldt-Jakob's disease. Myasthenia gravis is associated with the decreased myoneural junction transmission. Thymoma is associated with myasthenia gravis. This is the most common mediastinal tumor in adults. Even in if they ask like most common tumor in mediastinal, most common anterior mediastinal tumor, then also it is thymoma. Eaton-Lambert syndrome, repeated electrical stimulation enhances muscle power in it. So Eaton-Lambert syndrome, what will happen? Repeated electrical stimulation will increase the muscle power. Antegrade amnesia is characteristic of post-traumatic head injury. So anterograde amnesia is characteristic of post-traumatic head injury. So deficiency of intrinsic factor of Castle causes pernicious anemia. So deficiency of intrinsic factor of Castle causes pernicious anemia. Megaloblastic anemia is due to folic acid deficiency, and it is due to inadequate dietary intake. When megaloblastic anemia occurs due to folic acid deficiency, it is due to inadequate food intake, okay, dietary intake. Converging point of both pathways in coagulation is at Stewart factor, that is factor 10. Factor 7 deficiency may present with isolated prolongation of prothrombin time. This is important. 7 is important for extrinsic pathway, and there will be increased in PT. Okay, 7 factor increase in PT. A feature of hemorrhagic disease of newborn is prolonged prothrombin time. So hemorrhagic disease of newborn also there is prolonged prothrombin time. Bleeding time is abnormally prolonged in ITP. So idiopathic thrombocytic pinning purpura, there will be increase in BT. Gaze-Box syndrome occurs in dehydration. Remember, Gaze-Box syndrome occurs in dehydration. Gaze-Box is related to dehydration. Okay. Tumor associated with polycythemia is cerebellar hemangioblastoma. So polycythemia, what is the tumor associated? Polycythemia, cerebellar hemangioblastoma. Tumor associated with polycythemia is cerebellar hemangioblastoma. This can be asked. Okay, cerebellar hemangioblastoma is associated with polycythemia. Increased erythropoietin level is not seen in polycythemia vera. Okay, polycythemia vera, you don't see increase in erythropoietin level. Severe infection is not commonly seen in polycythemia. Presence of JAK2 mutation is an essential criteria for the diagnosis of polycythemia vera. So JAK2 mutation, where it is present in polycythemia vera, and it is a major criteria. Priapism is seen in bite of Spanish fly. Okay. Osmotic fragility is increased in hereditary spherocytosis. Seen in chronic inflammatory anemia is serum iron, serum ferritin, and transferrin saturation. I don't know. Cerebroblastic anemia is caused by INH. Okay, INH causes isoniazid causes sideroblastic anemia. Sideroblastic anemia is caused by INH. Pearson syndrome is congenital sideroblastic anemia. So sideroblastic anemia acquired can be caused by INH. So Pearson syndrome is congenital sideroblastic anemia. Pearson syndrome is congenital sideroblastic anemia. The commonest mode of inheritance of von Willebrand's disease is autosomal dominant. Autosomal dominant is the most common form of inheritance of von Willebrand's disease. Most common blood transfusion reaction is febrile non-hemolytic transfusion reaction. So there will be fever and there will be no hemolysis. That is the most common reaction. Root of aorta is the site of aortic aneurysm in Marfan syndrome. Very important. Marfan syndrome. Fibrillin is deficient. Okay. Fibrillin gene deficiency in Marfan syndrome. Defect in Marfan syndrome. And root of aorta is the most common site affected. Root of aorta. Reed index is used in chronic bronchitis. So Reed index is used in chronic bronchitis. Okay. Lung functions in emphysema reveal decreased diffusion capacity of carbon monoxide. Okay. So there will be decrease in diffusion capacity for carbon monoxide in emphysema. Sleep apnea is defined as a temporary pause in breathing during sleep. Okay, lasting for at least 10 seconds. So you stop breathing. When there is sleep apnea, the patient stops breathing at least for 10 seconds. Okay. And factor 10A inhibition is the mechanism of action of pentasaccharide. Oh, pentasaccharide cannot be digested by humans, and factor 10A inhibition, it causes factor 10A inhibition. Pentasaccharide acts by inhibiting factor 10A. In type 2 respiratory failure, there is low PO2 and high PCO2. So type 2 respiratory failure, there will be low PO2 and high PCO2. In type 1, there will be low PO2 and normal or low PCO2. Okay. Type 2 is commonly seen in COPD, And type 1 is seen in diseases which damage the lung as such, like pneumonia, pulmonary edema, etc. Most common cause of type 4 respiratory failure is shock. So what is the most common cause of type 4 respiratory failure? It is shock. In ARDS, type 1 failure is seen even in ARDS, that is acute respiratory distress syndrome. Type 1 respiratory failure is seen. Fractional excretion of sodium less than 1 is seen in pre-renal azotemia. So pre-renal azotemia, there is fractional excretion of sodium less than 1. Pre-renal and renal azotemia is differentiated on the basis of sodium fraction excretion. So based on the sodium fraction excretion, you differentiate pre-renal and renal azotemia. Here in pre-renal azotemia, there will be fractional excretion of sodium which is less than 1. This completes medicine past questions. I will come with the next subject in the next video. Keep seeing the videos and keep studying. Good luck.